Please hold on. Hello, and thanks for joining us. My name is Michael Hager. I'm the Manager of Technical Assistance and Dissemination at the National Quality Center. And we're so happy that you've joined us for our June Partners in Care Roundtable webinar entitled Spread the Word. This is one of the final webinars we're having as part of our End Disparities Learning Exchange. And we're really excited to have you here to talk about how consumers specifically can get involved in ideas related to spread and dissemination of clinical quality management learning and quality improvement in general. I'm hopeful that my co-presenter, Dolores Dockery, is going to be able to join us as we work our way through the presentation. But in the meantime, I'm going to be pinch hitting on her behalf. So we have a relatively small group of folks on the line. So maybe what we can do is just kind of go through really fast and say where we're calling from, and this will give us a sense of where each of us might be interested or kind of a little bit of our background in terms of what we're doing. So I'm just going to go down the list. My name is Michael Hager. As I said before, I'm the manager of TA at the National Quality Center, and I lead the End Disparities Learning Exchange, and we are based in New York, New York. Anna, can you tell us a little bit about yourself? And you are on mute, my friend. Let me see if I can unmute you. Oh, there you go.
Hi, my name is Anna. I'm a nurse clinician at the Rutgers, New Jersey Medical School Infectious Disease Practice, and I'm also the CQI chair.
Great, thank you. Welcome. Brian.
Hi, Brian Ballard. I'm from Rock Hill, South Carolina. I'm a consumer, first of all, and I've done a lot of work in regards to HIV as a volunteer, as well as heading my own initiative, which does free condom distribution and videography and photography, all having to do with HIV.
Beautiful, wonderful. Thank you so much and welcome. Brianne.
Thank you.
Hi, so I'm Brianne Wolf. I am from Columbus, Ohio. I am the Quality Improvement Manager of an HIV program here at Nationwide Children's Hospital.
Thanks so much and welcome. Dennis.
Yeah, I'm Dennis London. I'm from Minnesota with the Department of Human Services HIV unit. And I'm the Federal Compliance Specialist, and I'm in charge of quality improvement.
Oh, wonderful. Thanks so much and welcome. Some network perspective there. Elaine.
Hi, I'm Elaine Carter. I'm from the Detroit Health Department, and I'm a quality management specialist.
Beautiful. Another network perspective. Thanks so much, Elaine, for joining us.
You're welcome.
Emily Chen.
Hey, sorry I had to unmute myself. My name is Emily, and I'm the program fellow here at NQC, and I've been helping Michael a lot with helping the End Disparities Learning Exchange flow. So I'm here to listen and learn.
Thanks, Emily, and thanks for all the help you've offered over these 9 months. You've been extraordinary.
Oh, thank you. It's been my pleasure.
Great. Kimberly.
Hi, I'm Kimberly Diaz, and I am the data analyst with the Dallas Family Access Network, which works in conjunction with the UT Southwestern Medical Center.
Wonderful. Thank you so much. Mr. Bivens.
Hey, I'm Michael Bivens. I'm out of Rock Hill, South Carolina also, and I'm the consumer co-chair of the Charlotte TGA Quality Committee.
Beautiful. Thank you, sir, and thanks so much for joining us today. Mike Torres.
Hi, I'm Mike Torres. I'm a health planner with the San Jose TGA in California.
Great. And which San Francisco, which TGA?
San Jose.
Oh, San Jose. Wonderful. Thanks so much and welcome. Randall. Nope, let me unmute you. I can't unmute you, Randall. Sorry about that.
Former member of the
there you are.
Consumer Board.
Thanks so much, Randall, and sorry about that. Sorry, I didn't mean to be talking over you a little bit. Robin. No? And Scott.
Can you hear me?
Yes, sir. Hello.
Oh, great. My name is Scott Sullum, and I'm from the Rockland County Health Department. It's a suburban community about 30 minutes from New York City. And I'm the program coordinator of an HIV program that does medical, case management, outreach, and housing.
Wonderful. Thanks so much for joining us, Scott. And you live in a beautiful area. I hope to make it up to Bear Mountain sometime soon.
Yep, we're only about 10 minutes from there.
Oh, wonderful.
Do you know, when I started this, there was a little red, a little signal that said I could mute and unmute my own sound, and now it's kind of disappeared.
Oh, yeah.
Do you know how I can mute myself or unmute?
Yeah, thank you so much for that. For those of you who have dialed in and don't necessarily see your name and don't see the slides, you can press *6 to mute and *6 to unmute. Also, Scott, and for everyone else on the line, if you look at where your name is in the list, you can move your mouse to the right of your name, and a little microphone will appear. And you can click that when it's orange, you're muted, and when it is not orange, you are unmuted. Thanks for that great question.
Well, amazingly, I don't have a list. I see you on a video screen, and I see two other participants on camera, but I don't. Yeah, but I don't see. I don't see the list.
For everyone else, if while I'm talking right now, if you put your mouse over my face, in the upper right corner of where I'm talking, you'll see that there is a little list and a little quadrant, and then some arrows that go catty corner. If you click the first one that says list, the list will reappear and the camera views will go away.
Okay, thank you very much.
Absolutely. So just some ground rules. We would love for you to actively participate and write your questions in the chat room. Try not to put us on hold. We're a really small group, and if there is any unwanted distractions from on-hold music, I'm going to go ahead and automatically mute you. Similar, if there's someone walking behind your desk and having a loud conversation or popping into your office asking questions, I might mute you as well. The goal is just to make sure that we have a recording that is useful for people who are able to join us later on. I will be sending an email after today's call that will include the recording, the slides, and then also a link to the webinar evaluation for today's call. For those of you who may be joining us just for the first time, the End Disparities Learning Exchange is a 9-month initiative. We're in our last month, and really what we wanted to do was to highlight what we can do around disparities in HIV care. We used 4 subpopulations as an example to come together as a community of learners across the Ryan-White HIV/AIDS program system. There are many webinars that we have done, and they're all saved on our website, enddisparities-exchange.org. In addition to a number of resources and tools that we have discussed and have been sent to us as part of this learning exchange by all of you in the Ryan-White HIV/AIDS program field. So please go ahead and check out our website and look at some of those resources that might help you in advancing your project and your thinking around disparities in HIV care. This, of course, is just one of the many things that National Quality Center does. And while our funding with our federal partners expires on June 30th, and some of this framework is likely to change in the new cooperative agreement, for the next week and a half, you can access all of our services free of charge by going to our website, nationalqualitycenter.org, and by having a surf. So I think that my friend and colleague, Dolores Dockery, has arrived. Dolores has been very much involved in what we do at the National Quality Center for a number of years now as one of our peer coaches, and then prior to that as a member of our Consumer Advisory Committee. Ms. Dolores is also one of the powerhouses in terms of consumer involvement, both nationally and internationally, and has been key to the rollout of the People Living with HIV Stigma Index, in addition to many other important initiatives that affect all of us. And for full disclosure, I too am a person living with HIV. I've been positive for 15 years now, so it feels like a long time, but I know that for many of you on the line and many of us that, in the field, I'm still kind of a baby. And there are plenty of folks who have been living with HIV for more than 30 years who have been participating in our events. So Thank you so much for joining us. Thank you so much for all you do. And at this point, I'd like to turn it over to my friend and colleague, Dolores Dockery.
Well, thank you so much, Michael, and I'm just pleased the number of people who are on this call and really think that what we are doing is valuable as community members, and we have a role to play, and I'm just so excited that we are here today. So as Michael mentioned, I am HIV positive. I have been for 23 years, and for most of those years, I've made sure that I get invited to as many tables as possible, because I think that as impacted individuals, we have a role to play in addressing the issues that impact us, whether it be policy issues or access to healthcare issues or the quality of service that we receive. And when we talk about spread today, that's what we're talking about. How can we as community members, as impacted individuals, really work to spread the word about quality improvement and really address some of the disparities that we have identified. So our agenda today is, and I think we've done the welcome and introduction, we are going to talk about what is spread. Define it for us, and we want to get your input on what you think it is. We're going to look at projects that involve our community, and we're going to end with a question and answer session. So definitely, we want to make sure our work to improve health outcome of all our brothers and sisters stay with us, but make it out there for others to learn from, and that we will open up the webinar for your questions in the last section. So our learning objective is really to explain what spread is and its importance in quality improvement work. We're going to try and list 2 ways the Ryan White HIV/AIDS program consumers have gotten involved around the country to achieve health equity. And we're going to explain the next step you can take as a consumer to continue to advance quality around health equity. So we're going to start, and Michael and I are going to try and work together as a team. But we're going to start off looking at what is spread. So I want to, before we even start there, can anybody who is on the call just kind of unmute yourself and kind of let us know what you think spread is? We don't seem to have any takers. Anybody?
Oh, man. Any brave souls, calling all brave souls.
Because we know that the experts are in the room. We know that this is something we deal with in our community. When we talk about spread, what are we talking about? You know, anybody?
I think it's about spreading change and innovation and sharing that information so that more and more people learn from your experiences.
Excellent, excellent.
That's right.
Anybody else?
I think it's also spreading the word about these opportunities that we have as consumers to join in the process.
Absolutely.
Totally. Go ahead, Michael.
Yeah, so thank you for both of those points. Those are both very much involved in what we mean when we say spread. Spread is just another word, or it's kind of like, you know, jargon in quality improvement for dissemination and just kind of spreading that learning around. And that learning is multifold when we think about this from a consumer perspective. We want to make sure that from a consumer perspective, we are invited to the table and that we are continually engaged in this work and that we pass that forward to other consumers and our own experience that we learn as people living with HIV so that our brothers and sisters who are also living with HIV can become just as involved and engaged and can help be a positive change agent. But also, in addition to that, as consumers, we can help take the message of what's happening within our system of care or where we receive our care and to help spread that around some. That is either by going and talking to other consumers about the great work that's happening where we receive our care, or that could be by going and talking to other service providers, either as a member of a focus group or some other process by which you can say what's worked for you and what's not worked for you at a specific agency. And maybe even exploring some of the ideas around, you know, what some of the possibilities were, what was discussed as something that would be important to try, and what was discussed as something that might be less advantageous to try. So when we talk about spread from a consumer perspective, we're really trying to think about all the different ways that consumers can help empower and engage other consumers, but also that the ways that consumers can help spread the word about the great work that's happening within agencies where we receive our care. So there are actually two partners in care roles that we've emphasized here in terms of thinking about spread. And we can go to the Partners in Care page after we're done talking about this slide, just to refresh everyone's memory where to find some of this great information on what you can do. Dolores, I don't know if maybe you want to talk a little bit about being an ambassador.
Definitely. So when you're an ambassador, it's about the spread is about sharing and talking. So last week there was a state conference here in New Jersey, and you know, because I've been doing this work on N+ Disparities campaign, I wanted a venue where I could spread this word among my community members. I wear double hats. Still, I am considered a provider, but I'm always a consumer. And so I had the opportunity to do 2 workshops. And in those workshops, I was able to talk about the N+ Disparities campaign, what it was, the resources that were available, but also talk about my role as a consumer and the fact that, you know, where do I see myself in this process? So that's what an ambassador is. An ambassador is about spreading the word and talking to our community. Our goal is to, you know, end disparities and to talk about the excellent work that is occurring and where it's occurring and where people can find the resources. And most importantly, what we can do as consumers, the role we can play, and how we can be a part of sharing the work in our community. Keep in mind that we are at all stages of the process. We are in our clinics where we can share the word, and we are in cabs where we can talk about what is going on and what we have learned and share that. And we are in EMAs and TGAs, so there are many opportunities for us to do this work and talk about what is happening.
Absolutely. And just to kind of think about the next one as an architect, Ms. Dolores touched on some of the areas that architects are at play. And architects are people who are involved in setting up the system. So thinking about being part of a consumer advisory board, being part of a clinical quality management committee, being part of a quality improvement team, you know, or just having opportunities to really be involved in a discussion around performance measurement and what that means and what type of interventions might improve performance around certain key domains. These are ways that architects get involved. And granted, there is a little bit more of a sophistication around being an architect because you really need to have a solid understanding about what health statistics and health data means and how that relates to our own health care, our own well-being, our own emotional state around all of these things. But there are a number of resources available for folks to kind of come up to speed and quickly learn those skills to become an effective architect. I think one of the yeah, go ahead, Ms. Dolores.
No, go ahead and complete your thought.
Yeah, I was just going to say, I think that there is just a small barrier for most people to become an architect, and that is, one, to get over fear that we might have of math, and then to gain those skills. You know, and I invite all of you who are interested in learning about becoming an architect to kind of look through the architects area of the Partners in Care webpage, and to just ask me or Dolores or any member of our team if you have any questions. We're all accessible to you, and we're all available to answer questions should you have them. Were you going to say something else?
Yeah, so I wanted to hear from you all because I don't want Michael and I to be the only voices. So I wondered, do you have any stories or examples that you would like to share of when you were an ambassador or an architect? And I know we're using these terms and you might not be familiar with the terms, but basically what I'm asking you is, have you an opportunity where you as an ambassador was able to share what you've learned around quality improvement? Or have you as an architect in your CAB or your TGA or your EMA or your facilities or on any of your committees have an opportunity to talk about quality improvement? And I would love to hear just one or two examples of that.
I'd like to speak from the perspective of being an architect. I'm in the process of developing our first quality improvement, quality management program here at DFAN. And one of the things I've quickly learned is that a quality improvement plan should be unique not only to the group that you're looking at, but also to the environment that you're in. So a quality improvement plan that may work well here in Dallas won't necessarily work in rural Mississippi or in New York City. And so that has been the most overwhelming thing, I guess you could say, that I've learned, because the one-size-fits-all is absolutely applicable here.
Right. Absolutely.
And what your one size does not fit all.
I think that's really important learning. Yeah.
That's excellent. Anybody else would like to share? I am sure there are a number of people here who are involved in their community. So, you know, really just pretty much sharing your involvement from any aspect would definitely help us to understand what's going on where you are. Yes, go ahead.
Okay, so I'm going to go ahead and just show a little bit where to find some of these resources in case you haven't seen before. You can see I'm on the enddisparities.exchange.org website, and if I click Partners in Care, I'm led to our framework behind Partners in Care. There's an opportunity for you to read up a little bit about the history and where we've developed these resources from. And then there is a general toolkit, just kind of that anyone in any of these different roles would need to know around HIV. And then there are specific toolkits available for folks who are interested in becoming, you know, a specific role regarding their involvement in their system. So you can see in the general toolkit, really we're talking about the very basics. What is a partner in care? What is quality in care? Who are people living with HIV? Why are they important? What is the End Disparities Learning Exchange? And then general web references in terms of Ryan White services, living with HIV, information about HIV. In a way, you can think of this almost as an HIV 101 and a QI 101 put together as a way to just kind of get your toes in the water, thinking about becoming involved in clinical quality management at your site. Then when we get into the role-specific toolkits, we can see a whole bunch of specific resources that are available to help further your involvement in that role. So the architect is a lot of basics on performance measurement and on priority setting in terms of identifying interventions that will help to improve performance around a certain measure, say viral suppression, or say PAP screening, or any of the other items that might be important and relevant to you in your area in terms of thinking about health equity and ending disparities in HIV care. So one of the things that we'd really like to do is to share with you some of the stories that have come from the field in terms of what people living with HIV have actually done around disparities in care. I think this is really important in terms of helping us to understand and to model for you what we mean when we say spread, because we're actually spreading work that happened in the field by talking about it now here with you. Okay. So, and Chep, sorry about that. I muted you because I could hear some stuff on your line. First, I'd like to start with the Washington University of St. Louis. The Washington University of St. Louis is located in St. Louis, Missouri. A project was started there that was led by one of our spokespeople, who's also a member of one of our, she's a member of our National Quality Center Consumer Advisory Committee. Her name is Nishi Parkinson. And what she did was she convened her own consumer advisory board that was a long-standing group meeting at Washington University, and she trained them on the basics of health numeracy or health statistics so that they would have a sense of what it means to measure performance and what these performance measures and indicators meant. So basically she was able to help people understand what is this measure, where did it come from, and why is it important, and what are we trying to do to make it get better? These basics really help to take that cab from a group of people that provided very loose and basic recommendations around services provided to something that became much more sophisticated, because now people are able to understand a little bit better what these percentages mean and how we might be able to get them to get better. So what she did then after that first meeting was to have a second meeting where she walked through the disparities calculator and filled in the calculator with consumers in the room, and she answered all of their questions. At the end of the meeting, she asked people to walk away thinking about what disparities they learned about using this scientific calculator and what they would do when they, to fix this. So a third meeting has been scheduled for them to kind of think about this in between looking at the calculator and when they make decisions that will be forwarded to their overall committee. So we can see here what Nishi did. Nishi worked as an architect to train other architects. And in a way, she's also helping to be an ambassador for the overall program, because she's looking at the data that is available to discuss with those architects. And in some way, she's going to find things that are important to improve and spread that word around the community about what's important to improve. And she'll also learn what they're doing really well, so she can spread that around the community too. Right? Because we want to make sure that when we're talking about work happening in the community, that every time we have something good to say, that we have something, you know, that is important for us to think critically about. And anytime we say something that's important for us to think critically about, we should probably have something positive to say too. This way, we're maintaining balance in the discussion that we have with our peers, our brothers and sisters also living with HIV, but also with other providers that might consider similar paths to us. So there we go. Dolores, I don't know if you want to share another one.
Yeah, consumers have been providing input into a number of projects all over the country. We know that as members of the community. Most of these folks are formal architects. They're members of quality improvement teams or committee or larger quality improvement committee, who weigh in on different matters in a one-to-one basis with staff. It's been brilliant to see how consumers from different backgrounds in different parts of the country have made headways in different areas. If you want to be connected with one, please let us know. In some states, the whole state has moved to generate a new group of consumer architects to help propel the quality improvement program into the wow. In Fort Lauderdale, for example, there is an ongoing call for folks from diverse backgrounds to join the Planning Council and to weigh in on quality of care. In North Carolina, the state just trained more than 60 consumers around the state to participate in key administrative and quality discussion at the state level, regional and overall levels. And where I am in New Jersey, we have just expanded our Quality Improvement Committee that is primarily run by the recipient, and really have, she's invited more consumers to be involved in that process. And like our previous contributor who talked about the importance of the uniqueness of a quality plan, consumers are really involved in developing this plan for us in our EMA. Michael?
Thanks so much, Dolores. I don't know if anyone on the line from Florida or the Carolinas or from any of these other places that we mentioned wants to share a little bit about some of these moves in their state and some of the hopes that they have around clinical quality management and quality improvement around disparities as a result.
I'd like to speak up about some of that. So we recently had that training there in North Carolina, and we had about 70 people, and that made me really happy because for a long time I've been the only consumer when I've been down here in South Carolina on our quality committees. So seeing some more people involved is really good, and I'm seeing that some of those people from our training are now becoming more involved in what's happening at the state level too. So I'm really glad they came just to do a spark and get some more people involved. That's been really nice.
Thanks so much for sharing that. So one of the most common things people living with HIV around the U.S. Who have been engaging in this work have done is basically just to get trained. And we've just heard that that's one of the key things that a lot of us have as barriers, I think, psychologically to getting involved in the work. And we've heard the testimony of a couple groups in today's webinar now, and then certainly over the course of the year, stating that that really is one of the most important things you do, just get trained. The importance of consumer involvement in quality improvement is consistently echoed through the community. We all feel that we're important participants, and the providers know that we're important participants too. And for folks that have been attending health numeracy and literacy trainings, trainings on how to become a trainer to help other consumers to become more involved, trainings on how to be a leader and a champion for change, you know, they've found that it's been actually pretty easy in some cases to get involved with agencies once they're trained, and in other cases, they found that it's still not so easy. But training really is the first step, because once you're trained, we're allowed and able to work with you to kind of help find ways to utilize those skills that you've all learned. So one of the things to just keep in mind as you think about this moving forward as a provider or as a consumer is ways that you can get people trained, because first step is to get people trained, and then you can worry about how they're going to engage and where they're going to engage in the system after they're trained, because sometimes that's one of the things that we can do as consumers. Once we're all trained, we can meet independently and have discussions amongst ourselves in terms of strategizing how best to approach different groups of providers in our region so that we can become meaningfully involved in quality improvement within our region. Yeah, I think the last thing is that even if you're not able to become, you know, a solid part, an official member of a clinical quality management committee or a quality improvement team, there are opportunities like the People Living with HIV Stigma Index, where you might be able to find a way as a group of consumers in a region to start this work, to work with other consumers in your area to interview them. And I think that there are some resources available that Dolores could tell you about. And that would be one way that you could continue this effort as an independent consumer that's not necessarily working as part of a clinic team. Dolores, I don't know if there's anything else you want to add on that.
No, not necessarily on that. I would just direct people to the Stigma Index website for more information. Also, be aware that the facilitator for the Stigma Index at the national level is the U.S. People Living with HIV Caucus. And they can really provide more guidance on kind of the activity that's going on across the U.S. and provide some more direction. But I think what is important that Michael just said is the fact that each of us as individuals can play a role. And I'm going to share one example of somebody who is doing that as an individual. So in upstate New York, John, and I'm sure I'm going to mess up his last name, is Wiccara, has been an ambassador and an architect for many years. He convened a special consumer meeting and also shared information back to consumers through an online community he created himself called Central New York. And by constantly sharing good news of this work with people living with HIV around him, John is building momentum within the community to engage this work head on. So what we're saying to you is, while we encourage you to become involved in a team, a committee, your EMA, your TGA, or at your facility level, we as individuals can also do something on our own to build our own community and to build momentum. And I think the benefit for all of us is recognizing that what we are doing is improving the health care that we receive. That's the benefit for us. And so, you know, this is why we continually encourage consumer involvement. Michael?
Here. This is one of the reasons I love working Miss Dolores, is she will take me to quality church every day. Thank you so much for that, Dolores. Preach. So I just want to show you a little bit in terms of where you can find some of the information we've been sharing with you today in terms of what's been happening in the field. Here we are once again at our EndDisparitiesExchange.org website. And if you click on Community, click this link for Action Week submissions. Here you can see the different submissions that were submitted by folks from around the country. I think that there are a couple of other ones important for us to share that I hadn't mentioned earlier, but we heard about on last week's webinar. Stony Brook University's Caitlin Thomas submitted a description of the approach that she's taken in Long Island. And this is a super, super cool process. It's not too dissimilar to what Nishi did in Washington University, but they're just further along. And so what she did was she and her Consumer Advisory Board participated in the training to enhance their health numeracy skills, again, the basics of health math and statistics. And they presented to the CAB all the HIV care continuum data available for their area. And they also segmented this or broke it down by different races, different ages and genders, so that the consumers who are part of the board were able to see and to think about, you know, which groups test, which groups are linked, which groups are engaged, and which groups achieve viral suppression. And they had some time to think about this and came up with a number of different solutions. All of these solutions come up developed by consumers for the purpose of improving their performance and care. And ultimately, that means having longer, more productive, healthier lives. So that one, I think, is a really cool one to read if you have a chance. But we really invite you to come and look at all these. They're multimedia. Some of them are videos. Some of them are tools that have been submitted. Some of them are just narrative descriptions. But definitely, we invite you to check them out. You can also find them if you navigate to resources and then external resources. You will find them right at the top.
I'm hoping that these sources answer Brian's question. He wanted to know, how do you find those consumers? Michael and I have had problems for years trying to find them. It seems as if we press providers, but they don't assist much. I don't know if Brian wanted to talk more about his experience.
Sorry about that. Yeah, we were involved in a cab at our former clinic, and now we've been trying to get one started at our current clinic. But we've had several meetings, but there's been no forward. We've spoken with them extensively about getting these people, putting up flyers in very noticeable spots, as well as having a day where they schedule a lot of Ryan White patients so that we are there with a table so that we can talk to people about getting involved. But you really have to annoy these people, essentially, to get any kind of response. And, you know, when you've tried and tried and tried, it's like, where do you go from here? And it's been very difficult, and it's very frustrating to kind of work with these people or try to work with these people.
And I don't think I have a definite answer for you, but one of the things over the years that I've learned is that for people to get involved, they must know what the benefit is to them. And sometimes we need to identify what the benefit is to you, and maybe we have to do it on an individual level, not a general level. So what am I going to get out of it? What is the benefit? Oftentimes I tell people that I do this work because I'm saving my own life, but it might mean nothing to somebody else. So one of the things is, one, to identify the benefit to folks we're reaching out to. And then don't become frustrated. Recognize that if you only met one person, just one person who is willing to do something, that is success. Because sometimes if you only get one person, that motivates somebody else. So I encourage you not to become frustrated and to focus on the one. Michael?
Hear, hear, Dolores. I think that's excellent advice. And another thing to keep in mind, you can do this conversationally, or you can try to find a way to capture this more anonymously, is what we call a readiness assessment. And I don't want to throw too much jargon at you so that you feel like, oh my gosh, I have to create a questionnaire. But if you could think of 3 questions that you would ask someone that might identify what they would need to participate or what a barrier is for them to participate. Either you can make sure that you are filling needs, or you can make sure that you're mitigating barriers. Sometimes it's, you know, I already have to take 3 buses to get here anyway, and it just takes too long and I can't fuss. You know, that's an example of getting rid of a barrier, you know, so you find a way to maybe meet virtually, or to find a way to meet and only do living minutes, or something like that online, like through just an email thread. You know, thinking about meeting needs, Dolores' question is an amazing one. You know, what is the warm fuzzy for you? What is going to draw you and keep you interested in this work? But there are a number of ways that you can ask questions like this and to create a readiness assessment. And NQC staff is really interested in working with you on creating such readiness assessments, if you want to think about that. And again, it can be something that you ask very politely for your agency to add to their own survey, because that's a group of consumers who are already being surveyed and you know, kind of peppered with these types of questions. Or next time you do a table or something like that within your clinic, you can just ask everyone, you know, who comes by, and then maybe have a simple tally sheet of common answers. Just a couple of ideas from my end.
Thank you.
Yeah,
so Brian, I really want to you for sharing your story. I want to leave space for anybody else who would like to, you know, tell me a little bit more of the work you've been doing in your area around a similar project. Anybody, you know? Even I like how Brian talked about his efforts, challenges, and pretty much that's what we want to hear. You know, what have you been doing? What are some of your successes, and what are some of your challenges?
And I just want to say also, I mean, we've gotten as far as creating a survey, but it doesn't seem to be reaching the patient. I mean, as soon as we left a meeting, we had one of the people from the clinic email us within 10 minutes a survey that was fantastic. It was an awesome survey, but it's never been implemented. And I think that's a huge problem that we've always had is you know, it's the follow-up.
I'd like to speak to the issue of getting buy-in from your providers. One of the things that I found useful with getting the attention of the provider is speaking from a position of statistical facts. So as a data analyst, that's pretty much what I do all day. But when you can speak to specific things around, for example, the have measures, I think they may be more inclined to listen, at least, to what you have to say in terms of a quality improvement plan. Without that data, though, I think it'd be really difficult. So I don't think it would, you know, for most people, it would require much to put together some brief information about retention and care and visits, or you could just pick one of the 5 have measures, because it seems that almost every organization needs have some room for improvement in one of those 5, if not all 5. So I think if you approach them from, this is what our program could potentially help us do in terms of people living with HIV, you might be able to get better buy-in from your clinicians.
That's wonderful. Yeah.
Thank you.
I think that it's an important point to remember sometimes that depending on where we sit within the healthcare system, we speak a different language. And that's not a consumer versus provider thing. It's, you know, within the provider community, depending on the role you have, you might speak a different language. And of course, we all understand that the common problem of an administrator working with our federal partners to come up with a project, communicating that to the physicians, who then communicate to the quality person, who then communicates to the IT person. And by the time the IT person programs the database, all of a sudden the person at the top is like, we have to start over because this game of telephone was, you know, kind of not working for us. In terms of understanding as a consumer what the provider needs or wants to hear in order to feel good about something, it's really important. And as a provider, understanding that for your consumers to take you seriously, you need to follow through is really important, and that those are the languages that we speak. For consumers, if we're not familiar with something and we may not be as comfortable in the subject matter, we need to see and trust and know that you've got us. And so understanding that there is a survey that can be developed in 10 minutes is great. But if there's not the follow-through that survey is disseminated based on our thinking and our advice and the heart that we put into this, all of a sudden that decreases your credibility as a provider. And we may not want to sit at your table because we don't think the work that you're doing is worthwhile because there's no follow-through. So really important stuff in terms of understanding the language that we speak and how to make sure that we maximize the appeal to the other party when we're trying to engage in this type of relationship.
This has been really good discussion. I definitely want to open it up, continue to open it up in our question and answer section where we, you know, are there any additional questions anybody would like to ask at this time? Please, you can put it in the chat box. I am monitoring what is put there. Or just, you know, open your line and ask your question. maybe one of the things I also want to hear is, were there any aha moments for you on this session? Did you learn anything new? And are you planning to do anything that been boiling up in your head and you feel like, wow, I think I can do this? So please, just let me hear your thoughts. Well, we have about 5 minutes more on this call, so I definitely don't want to move on without hearing from you. But oh, good, I see. Oh yes. So Michael is telling you, please unmute your line. Ask any questions or put it in the chat box. I'll also see it there.
Is establishing, what are some of the challenges that we've had here? Is the challenge in establishing a relationship as a consumer with a provider or as a provider with a consumer? Is the challenge in making sure that we have opportunities for the consumer's work to go somewhere within a provider agency, or for the consumer's efforts to be communicated and spread across the consumer community? Where are some of the challenges in terms of this landscape? That way maybe we can have a conversation around how to work together or how to improve or mitigate some of those challenges. We're feeling so shy today.
I'd like to speak to one of the challenges I've noticed.
Please.
It seems that for some programs, there's a lot of unwillingness to share some of the resources because some of the programs that people have put together, they have a proprietary feel to them. Mm-hmm. So I don't know that it's because people are looking to publish and they don't want to, give a heads up to some other group. But I think that, again, coming from a slightly different area of research, that seems to be a bit of a challenge, right? So people will speak, like, for example, I went to the Ryan White meeting last year, and people spoke on how great their programs were. And they said, okay, well, you can contact me if you want, and I'll give you some information, and then you contact them, and then you never hear anything back. So I've been a little surprised to be back in a public health space where there doesn't seem to be the free-flowing information that I think I thought there would be, and so that's kind of been a problem. But with that said, I think that the resource pages you mentioned could work really well. So as opposed to reinventing the wheel, just kind of borrowing some ideas from what other people are doing would certainly be useful for creating a new program.
Thank you so much for raising that, Kimberly. I think that that's a really important point. And, research definitely is something that people have their kind of protectors and, around. But quality improvement isn't research. And I think that sometimes there's still a little bit of confusion by folks in the field around that. I would argue that, we're only hurting ourselves to have a proprietary mindset around quality improvement interventions. That the idea is that, we benefit through the interaction and learning, of many and not a few. But I think that it sometimes takes a long time for folks to wrap their minds around that. I think the other concern then around this sometimes when we get confused about the difference between quality improvement and research is then, oh, we have to involve an IRB in looking at this data. No, you don't. This is not research, and we're also not talking about individual client level data, going around anywhere. So I think that it would be really interesting to create some type of group to talk about sharing and areas and times when sharing doesn't work as well. I found that in the National Quality Center collaboratives that we've worked very hard with our federal partners on, that's oftentimes one of the initial barriers. And if it wasn't for the patience and grace of our federal partners to really say, like, it's time to share, the time for not sharing is done, and it is our expectation that you will share. All of a sudden, a lot of those arms become uncrossed and the doors begin to open and information starts to flow more freely. It sometimes does take a while for people's heart and minds to catch up with, what we're trying to do and to kind of leave behind the idea of research and proprietary and kind of patient protections. Because of course, we're all trying to learn together. We're all trying to protect and serve the patient the best that we can. So I don't know if anyone else has had this issue and if there's any interest in maybe creating some type of discussion group, at some point in time around ways that we can maximize sharing within our regions or even within our agencies to overcome that barrier that I'm competing against you, because in reality, the most important thing is the patient and the patients we serve in common. So screw all that other stuff, in my humble opinion, as a person living with HIV and someone who's been involved in the service system for a while.
Yeah. So Michael Biven had an interesting comment in the chat box, and I wanted to give him the opportunity to just kind of share his thoughts with us. Michael, if you will just unmute your line.
Yeah, so I was really glad hearing some of this today. I think I learned a few new tricks, and I see that I'm on track with a lot of the other stuff. Brian and I were talking, and I'm like, sometimes when you present this stuff, it's so linear, and it sounds so easy, step A, B, C, D, but sometimes it's not that way. We're a little ahead in one place, we're a little behind in another, and some of the tricks you used at one agency don't work at the other agency, and it's trying to find your way and muddle through all that. But I feel good about the things we're trying because I heard some of those things in the discussion today.
Good. Thanks. Michael?
Yeah, so I think that we're about up with our hour here, so I just want to let you know that we have our final webinar for this 9-month initiative tomorrow. It's a journal club where we're looking at the roles of social workers in shaping quality of care as a way to get to zero. A transdisciplinary team is another way of thinking about the overall care team that serve our patients and that we as patients interact with. And it's a way for us to think about how social workers are very core and critical to that central team and that central team's efforts in quality improvement. And we're going to be sharing some data from the in+care campaign to make this point. Our friend Terry Fox in New Jersey and Adam Thompson, also in New Jersey, are going to be joining us for that presentation tomorrow at 1 p.m. Eastern. And at this time, I don't know, Dolores, if there's any closing remarks that you'd like to make.
I want to thank everybody for their strong participation in this discussion. I totally agree with Michael that we all need encouragement as we continue to do the work we do, and that, yes, it's not linear, and we have to celebrate the small successes, but we definitely need to keep doing it. I also want to underline the importance of training, making sure that we use every opportunity to build our own capacity and to share that knowledge with other people in our community. And the National Quality Center has a wealth of resources that we can tap into. So thank you all.
And just to echo Ms. Dolores' sentiments, thank you so much for participating today. We are so grateful to have you as participants in this initiative, and we wouldn't have been able to do this without you. So we hope that this has added value to you and to your thinking around quality improvement, whether you're a consumer or you are a provider. And we're really excited to see where you all take this ball as you continue to run with it down the court beyond July 1st. So thank you so much for participating. Thank you for your time and your attention and your heart, and we will see you very soon. Bye, everyone. Have a wonderful day.
Thanks. Thanks so much.